Good morning. Welcome to Active Aging with Barb. My name is Barb Eisenberg. I'm a physical therapist assistant and also a licensed massage therapist. I work with therapy at home, and our passion is to inspire seniors like you to live happier, healthier lives so that you can age successfully and independently with a positive attitude. Together, we can create possibilities as we get older and better. So this is February, American Heart Month. We've been talking a lot about heart health. Today we're going to be talking about brain health. And just like you can have a heart attack, you can also have a brain attack. This is the new way to look at strokes. Calling it a brain attack really makes you understand that it's a very serious occurrence and you really need to act fast, just like with a heart attack. So we'll talk for about 5 minutes about stroke. Then I will go into our exercise program for about 25 minutes of moving as many muscles and joints as possible, strengthening our muscles and mobilizing our joints. So that's the plan for today. Remember, this information is for education only. It's not meant to diagnose any specific condition. And if you do have a question about your own body, make sure you consult your own physician or your healthcare provider. That being said, why is stroke important? Strokes happen to about 700, there are about 700,000 strokes that happen in America every year. And it's even more higher of a risk for African Americans than it is Caucasians. So those folks really need to listen today and make sure you know what the symptoms are. Everyone needs to know those symptoms, but African Americans especially are at a higher risk. The other thing is that strokes are the #1 cause of disability in America, #1 reason that people are disabled. So we really want to prevent them as much as possible. And 80% of those events are preventable. We'll talk a little bit more later. So what is a stroke? A stroke is, there's two different types. There's an ischemic stroke, and that happens when there's a blockage in one of the arteries that supplies blood to your brain. When that artery becomes blocked, the brain tissue that's supplied by that artery begins to die. So you want to get help as soon as possible, just like a heart attack. The other type of a stroke is called a hemorrhagic stroke, and that's when an artery actually bursts and there's bleeding in the brain, and that's also blood to brain tissue is actually toxic. So that also causes damage to your brain. So two different types. There's also something called a transient ischemic attack, or a TIA. Some people call it a mini stroke, and it's symptoms similar to a stroke, but the symptoms go away. So it's temporary, but it still is a very important thing to know and to remember to get that checked out as soon as possible. It's indication that there's something wrong and you really need to address it. So both types of strokes can damage your brain. We need to know the symptoms of a stroke. And you can remember those symptoms by thinking FAST. So F is for face. You look at your face or the face of the person you're wondering about. If their face is symmetrical, that's good. If one side is drooping, or maybe the eyelid is closed halfway, or they smile and it's not even on both sides, big indicator that they may have had a stroke. A for arms. If one arm is weak, if one arm is numb, if you raise up both arms and one of them just kind of drifts down and you can't hold it up, another indicator that you may have had a stroke. FAS. S is for speech. So if you are unable to speak, if you're speaking and it's not clear to the other person, if it comes out kind of garbled. It happened a couple years ago to a news reporter while they were on the air. She was speaking and she wasn't making any sense. Luckily somebody saw that and got her to help right away. So S for speech, F face, A for arms, S for speech, and T for time, meaning get help as soon as possible. The sooner you get treatment for a stroke, the more likely you are going to have a full recovery. Oftentimes, about 40% of the strokes that occur 2 years later, people still have moderate impairment from that stroke. So important to really get help as soon as possible when you see any of these symptoms. But remember one really important thing. 80% of stroke and cardiac events are totally preventable. Know your risk factors. Smoking, high blood pressure, high cholesterol, diabetes, being overweight or obese. All of these things are things you have control over, and you can work on them and you can get them under control so that you can lower your risk factors. Keep working on it. Get active. You're doing that with me today, so that's great. Exercise every single day. Maybe take one day off. Exercise every single day. Doesn't have to be a lot. You can do 10 minutes in the morning, 10 before lunch, 10 before dinner. Easy to work into your schedule. Today we're doing about 25 minutes, but remember, if you haven't been active for a while, you want to make sure you get an okay from your doctor or your healthcare provider. If you're exercising and you start feeling any kind of symptoms, chest pains, shortness of breath, dizziness, stop immediately and get checked out. With that being said, let's get moving. All right, we always start with a warm-up to get our bodies ready to exercise, get the muscles warmed up, get the blood pumping, get our heart rate up and our breathing rate up. So take nice deep breaths, blow it out. Got to adjust my little microphone back here. It's getting in my way. There we go. All right, now I can swing freely with my arms. All right, we're marching. Marching. And we'll switch it up with a kick. Kick and kick. Kick and kick. Warming up the hips. Kick to the front. And you can move the arms if you want to add some more effort. Reach with the opposite arm. Kicking. Now we're going to kick across instead of to the front. So we get a little more hip stretch, a little more rotation on your spine. I'm thinking a lot about the spine today because mine has been a little stiff and achy. So we'll try to do a little extra work on the spine. Kicking across. Keep kicking. If you're feeling a little looser, you can kick higher. You can kick faster. You can add arms to the sky. That increases your heart rate. Anytime arms go over your head, it's going to increase your heart rate. Amazing what a little thing like that will do. All right, reaching up. You can reach forward, reach one arm. Standing tall, always trying to work on posture. Breathing deep. Let's do a circle and bend our knees. And a circle with the other arm. Bending our knees. When you pump those legs, you're activating this large quadricep muscle, the front of the thigh, and it really helps. Let's do both arms. And to the front. And let's do side together. If you've watched before, you know any side to side motion is activating the hip abductors. And those hip abductors, these side hip muscles, are really important for balance. As we get older, it seems our balance isn't as good, so we really need to work on it. It's just like a muscle. If you work on it, it will get better. So keep working on your balance. Keep working on your strength. Our bodies are amazing machines. They will respond if you work them. So we're stepping side to side. Let's add an arm. Reaching up, and bending the knees. Reach and tap. Reach and tap. Reach and tap. And I'm going to reach forward. This is more of a punch. Reach, kind of stretching out the shoulder. And up again. Reach and tap. Still warming up. Should be feeling a little warmer, breathing a little harder. Reach and tap. Reach and tap. Remember, this is your time. So you got to listen to your body and go at your pace. You decide how much you want to push yourself today. Might be different tomorrow, but it's up to you. You have the power to change your body with your mind telling your body what to do. Back to kicks. All right. Good job. Keep the arms going. Nice deep breaths. And I'm going to do a high march. Loosening up the hips a little more. Good work. So one arm up, opposite knee. If you want to reach over, you can try to touch the elbow to the knee. Getting a little ab work in. So when you do this, you're working the abdominal muscles. And you're also rotating on your spine. So you're getting a little more mobility in your spine. You don't want to get a stiff, achy back as we get older. All right. Let's loosen up the shoulder with a figure 8. Bend your knees and elbow up. Make a circle and then make a circle in the back. Circle in the front and to the back. Big circle. So we're rotating the shoulder and we're also rotating the spine. Notice my chest is forward and then to the side. And make your circles bigger if that's comfortable for you. Reaching all the way down, all the way up. Reach all the way. I'm hearing some cracking going on. Things are getting looser. Some popping. Other arm, starting smaller. Figure 8. And getting bigger. And bigger. Shoulders are so important for our posture. As we get older, even some young people I've noticed have very poor posture. They're kind of walking like this. We need to open up the chest, lengthen these muscles, strengthen the upper back. Sometimes these upper back muscles get overstretched from hunching over a desk or a tablet or whatever device you have. And we really need to open up the chest. Big figure 8. All the way down if that's in your comfort zone. Couple more, and then we'll do both arms together. Circle in front and circle behind. So now we're getting more movement in the back, so rounding the back, reaching forward, and then arching the back. So here we're trying to get a little arch and a rounding. And the arms are like levers, so when you pull them forward, it helps round your back, and when you pull them back, it helps arch your back. You may not feel any movement at first, because a lot of people are very stiff in the back. But keep working at it, and eventually your body will give in. And you'll be able to lengthen those muscles and joints to get some more space in there. Nice work. Circle in front and back. Good job. All right, let's do a little lunge. So one knee pointing to the side, other toe pointing forward, and you can even lean on this leg and reaching out. Reach as far as you can and then pull back. Reach and pull back. Reach. So we're shifting our weight, all the weight's on this leg, pushing up. We're also strengthening the core. So reach. Here we're strengthening the core and you're lifting, keeping it all in one line. Straight line from your foot to the tip of your fingers. Reach, pull back, reach, pull back. Two more, and reach. All right, let's switch to the other side. So turn your feet so they face the other direction. You should have a pretty good distance between your two heels. Bend that front knee, and you can lean on it if you like. Reaching out, loading up the side, and then pulling back. Reaching out, loading this quad, pulling up. You don't want to use your hips to pull you up that way. Use the tight core muscles, the abdominal muscles. So reach and pull. Reach a little farther, pull back. Reach and pull. Reach and pull. Three more. Two more. And one more. Good job. All right, let's do a straight leg raise to the side. So more hip strengthening. If you need a chair, toes are pointing forward and we're just lifting to the side. 3, 4. Make sure your knee is facing the front. You don't turn your foot out, but keep it pointing to the front. 5, 6, 7, and 8. 8 more. 3, 4, 5, and 6, 7, and 8. Should start to ache a little bit. That's just fatigue. Let's do the other side. So foot is flexed, and we're going 1, 2, 3, 4, 5, 6, 7, 8. 8 more. 8, 7, 6, 5, 4, 3, 2, and 1. Shake it out a little bit. All right, let's do the back of the hip. So knee is bent. You want to push your whole upper leg to the back. 4, 8, 7, 6, 5, 4, 3, 2, and 1. Other side, knee is bent. Keep your knees even. You're not swinging it to the front and to the back, just from the middle to the back. It's a small movement. For 8, 7, 6, 5, 4, 3, 2, 1. 8 more. 8, 7. Try to keep the rest nice and still. 5, 4, 3, 2, and 1. All right, let's do a little knee bend, a little plie. So we're working quads while we work our arms. So let's do elbow to knee. This isn't really working your arms. This is working core and side. So trying to go elbow toward your knee. Doesn't have to touch. We're working all around the middle. And at the same time, we're working the legs, the quad muscles, those big calorie burners. Side to side. Trying to keep your back nice and straight. Let's do 4 more. 3 more. 2 more. And 1 more. Good job. All right, bend your knees a little bit. Your toes can be pointing forward. Just want you to lower down, rounding your back about halfway. So your hands are about even with your knees. Back is rounded, knees are bent. And I just want you to push one hand toward the floor, kind of lift up the other shoulder. So you should feel this in your back, a nice stretch, reaching down with your hand, up with your shoulder, and other way, down with one hand, up with the shoulder. Should feel a nice stretch in your lower back. And switch, down with one hand, stretching out the back, and other hand, reaching down. So you're kind of pulling up with your back and down with your hand. Couple more, reaching down, and reaching down. Another great stretch for your back. If you have a chair, you can use the wall. I'm going to call this a modified down dog. It's a yoga pose. So hands on the chair and then step back until you can stretch your arms straight out in front. So you're pushing your hips back, trying to get horizontal to the floor. And then if you can, go a little farther so your head is dropping below your arms. Really good shoulder stretch and upper back stretch. Should feel good. If you can't go this far, just go to what feels comfortable for you. And then slowly walk up. Deep breath. Let's do that again. Walk back till your arms are straight out. Your feet can be a little wider than hip width. Make sure that chair is sturdy. Try to really press down so you're stretching out your shoulders. Deep breath. Gives a little bigger stretch in the shoulders. And then slowly come up. Very nice. Stretching out the back and shoulders. All right, we're going back to a little plie. So feet a little wider than hip width. Lower down. Back is straight. Knees are out. When you turn your knees out, you're activating the glutes. All right, so let's try going, stay in this position and then lift your heels a little bit. It's a strange feeling, but just give it a try. Just try to lift your heels up and down. That's activating your calves. So in addition to the quads working, we're now working the calves. Up and down. 4, 5, 6, 7, 8. 8 more. 8, 7, 6, 5, 4, 3, 2, and 1. All right, now let's go. Keep with your plie, arms straight out, and we're going to reach forward, forward, back, and back, then down and down. Again, you're getting a little stretch in your back. Forward, forward, pull back, down and down, pull up and pull up. Forward, forward, back and back, push down, down, up and up. Now let's push up and push up, really reaching. And 4. Might start to ache and burn a little bit in those quads. If it's too much, just get up and start again. Reaching in one direction, keeping that knee bend. We'll do 4 more, 3 more, 2 more, and 1. Good job. Really working the quads there. All right, we're going to take a step forward and bend both knees for a little lunge, stretching out the toes, stretching out the quad, working this quad in the front, and then push back. Same leg, step forward, bend both knees, Make sure this knee stays over your ankle. Don't let it go past your toes. And then push back. Big step. Lower down. So you should be feeling a little stretch in the front of the back hip. This hip, this quad is working. This one is stretching. We'll do one more. Big step. Lower down. Feeling a stretch here in this quad. This one is working. And push back. Other side. Big step. Lower down. Feel a stretch and push back. Big step. Lower down. And push back. Good work. Step and lower. Feeling a stretch in the front. Another one of those muscles gets very tight from sitting a lot. This little hip flexor. When this gets tight, it often causes low back pain or stiffness in your lower back. So let's do one more of these. And push back. Nice job. All right, let's stretch out at the hamstrings. So you can use your chair, or you can put your foot out in front. I like to use a chair, so we're stretching here. And we're also going to stretch out the IT band that can affect your knee. So toes pointing up, bending from your hip, and coming forward. Feeling a good stretch in the back of the leg. And you can turn it out. You'll feel a stretch on the outside of that hamstring and into that IT band. And then turn it in and out. You want to stretch all the fibers of that muscle. And other leg up or down on the floor, turning out and in. Bending from the hip joint, not rounding the back. A lot of people think they're doing the same thing. This is nothing. I'm not feeling anything here at all. So bend from your hip joint and keep the chest up. And breathe. Turning the foot out. Hold for a little bit. Get that IT band stretch. Kind of feel some real strong tension in there. Nice deep breaths. Should feel good. Let's stretch out the calf. So toe goes back. Try to press your heel into the ground. When your knee is straight, you're getting the long calf muscle. If you shift back, then you get the short calf muscle. You want to make sure you do both so your muscles are balanced. Other leg back. Toe back, and then press the heel down if you can. Leg is straight to start for that big calf muscle. And then shift back, bend the knee, get the little short calf muscle that attaches with your Achilles tendon. Good work. All right, let's make sure the neck is loosened up. So make a circle. Gentle circle. Need to be able to check our blind spot when we're driving, so circle in one direction and then slowly circle in the other direction. Standing tall. Always work in posture. Chest is open. Circle. Good work. Nice deep breaths. We're cooling down now. All right, let's do a little work on balance. So we're going to step to the side and touch for 3. Step to the side and touch for 3. Try to keep control. Step to the side and touch. Step and touch for 3. Side and touch. One more time, side and touch. If you need to have your chair in front of you, that's perfectly okay. But try to use it less and less so you're working those balance reflexes. All right, let's go up for 1. Back and hold. Whoop. back and hold. That was front, back and hold. One step and hold. Use that chair if you need it, but it's okay to wiggle. The wiggling is your balance reflexes. So you might use that hip action to get your balance. You might just wiggle your ankle. Step back, try to hold. Forward, hold. Back and hold. Let's switch. Other leg. Forward and hold. I feel like I'm doing the same leg. Back and hold. Let me try the other foot. Forward and hold. Back and hold. I've talked about hip strength in the past for balance. Standing on one leg for 1 minute 3 times a day has been shown in research to actually strengthen your hip joints. The actual bones are increasing in their bone density. So 3 minutes on each leg for 1 minute 3 times a day. 3 times a day, stand on one leg. You can hold on to something, but this is really good strengthening your hip muscles and your hip joint. Let's do other side. Trying to balance. We're not doing 1 minute right now, but you get the idea. Hold on to a chair if you need to, but really keep working those balance reflexes. They will get stronger. No doubt about it. Very nice. Let's do a little strengthening. We didn't do it much strengthening on the calves, so just go up and down. 3, 4, 5, 6, 7, 8. Let's try 1 foot. Up and down. 2, just for 4. And other side. Up and down for 4. A lot harder with just 1. And 4. Good job. Other side for 4. 3, 2, and 1. And the other side for 4, 3, 2, 1. You need strong feet as well as all the other body parts. We don't want any single muscle to get old or weak as we get older. So let's just loosen up some of the other joints we didn't really work with. Circle with your wrists. Deep breath. And blow it out. Deep breath. And reach. And reach. Let's just work it down. And reach. And reach. Shifting your weight. Shifting your weight. So we're stretching out the hips a little bit. Now you can hold on to this hip, stretch the inside of the leg. Deep breath. And stretch the inside of the other leg. Lean on this knee. Feel that stretch. Deep breath. Come up, another deep breath. Let out any extra tension that you have. And blow it out. Thank you for joining me. I'll see you next time. Till then, stay strong and be well. Bye-bye.